you eat a bunch of fried chicken. You really don't think about that fried chicken that you eat on a regular basis as having a massive impact on your health, but it does, right? But you don't think about it because it doesn't have an impact on your health on that moment in time. Right. But we need to figure out how to keep people more engaged in that kind of stuff, right? And we've done there are some great historical precedents for this. Tobacco, right? We have done an amazing job as a country of reducing tobacco use, right? I mean, it's almost almost anywhere you go in this country now, it's almost weird to see people smoking, which is an incredible feat. And so I think that that's a phenomenal baseline to kind of look at to say how can we do this across the board. But patient engagement, getting people more involved in their own health and their own well-being is a big deal. And then from the clinical perspective, I think there are a lot of things that need to change from the perspective of the physician, the perspective of the sort of administration of healthcare, that focus more on wellness, less on treatment, right? How do we keep you healthy as opposed to treating you when you're sick? How do we make healthcare less of a transactional enterprise and more of a sort of lifelong journey? So I read a great blog post a few months ago, which equated the adoption and effective use of electronic medical records to hand washing. And it was a really interesting analogy. Basically, the author said, look, we've known for a long, long time that washing hands between seeing patients is a good thing, that it prevents the spread of infection, that it keeps people healthier, et cetera, et cetera, et cetera. But yet, we still have problems with, we don't have 100% adoption of hand washing. And in fact, until recently, the rates of hand washing were still pretty low. And the point that the author made was that the reason for that was because providers, doctors, nurses, et cetera, have no time today. They operate on the red line, right? And if you have to walk outside of a patient's room, down the hall, roll up your sleeves, scrub up for 2 minutes at the sink, dry off, and then go see your other patient, you're not going to do it. But the rates of hand washing dramatically increased as soon as somebody smart had the idea of installing the alcohol gel dispensers on the inside of the patient's door, right? So that as soon as you were done examining a patient, you could literally, without breaking stride, squeeze a couple times, do this as you're walking to the next patient, and you're done, right? So the analogy is that if you can make something time neutral, then you can encourage better behavior. Part of the problem today is that these EMRs are so complicated and they're not necessarily as intuitive as they could be. And let's be honest, they're somewhat new in many respects, and so doctors and nurses aren't necessarily used to it, that they're taking more time and that they are taking time away from patients. And the way that we're going to get better at this is if systems can be developed which actually focus on time neutrality. How do we make it such that this system and the way that this thing works actually fits within the flow and fits within the way that we do things? And I just think that's a really interesting point. If I had to throw a theory out there, right? And this is like a very long-term theory that is probably my own personal theory that I have no idea if anybody else would agree to or not, so this could be completely nuts. But I could easily see personally, 30 years from now, a system of healthcare in this country which is sort of regional integrated providers where they're both the payer and the provider sort of all in one big network, where maybe you've got your West Coast system and your Northeast system and your whatever, we have less of, and it's less of a system where the providers are here today and the hospitals are here and the insurance companies are here, right? I mean, because when you see some of these integrated systems, they do tend to have much better alignment of incentives across the board from the patient and the provider and the payer perspective. And so in some respects, given a lot of the elements of the Affordable Care Act and the fact that we have to bend this cost and quality curve pretty dramatically, I can see an integration of these entities happening. But I think this is a long-term play, right? This is not something that happens overnight. And then as a result, you can imagine the entire tech stack has to change, right, to support that effort. So, how long will that take? Will it happen? I have no idea. You're seeing, I think, some motions of that today where provider groups are actually saying, you know what, we can actually do this payer stuff. We don't necessarily need to go outside of our group to do it, because at the end of the day, it's math, right? So it'll be interesting. But I could see a world like that.